Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. It's been widely noted that pulse oximeters, devices used to read blood oxygen levels in hospitals and at home, are far less reliable for people of color and especially darker-skinned patients than for white patients. The error results in readings that are falsely normal, creating the potential for clinical staff to miss life-threatening complications. On Monday, July 8th, we're launching a special 3-episode series. That's all 3 episodes available at once, exploring the issue of racial bias in pulse oximeters. We'll look at why this long-standing problem only caught the nation's attention in recent years, despite the fact that there were known issues that were largely ignored by manufacturers and regulators. We'll also dive into the history that led us to the flawed devices that are used in hospitals everywhere and available for consumers on the market today. Finally, we'll hear from advocates from across the medical spectrum, including patients, clinicians, students, and scholars, about where we go from here to demand equity and ensure that it's built into the future of medicine. Look for this special series on Monday, July 8th, wherever you get your podcasts, or go to publichealth.jhu.edu/podcast. How can we make cities around the world more mental health friendly for young people? Today, Dr. Pamela Collins of the Johns Hopkins Bloomberg School of Public Health joins Stephanie Desmon to discuss how urban environments impact our mental health and what can be done at the individual, community, and policy levels to make improvements for our youth. Let's listen.
Pamela Collins, thanks so much for joining me.
It's a pleasure to be here. Thank you so much for the invitation.
So I wanted to talk to you about a recent article that you published on making cities mental health friendly for young people. First of all, I want to know what that means, and then I want to know what prompted that research.
Yeah, that's a great question. The idea for this project came from recognizing that cities could be an incredible venue for interventions that support the mental health of young people. We know that our mental health and well-being is shaped by our environment. And in the United States alone, 80% of our population lives in cities. And around the world, cities will be home to 70% of the world's children and adolescents over the next 25 years. So putting that together, the importance of context, the importance of environment, how do cities support mental health? So we were excited about the prospect of how they might serve as interesting opportunities for multi-sectoral interventions, right? What can transportation do? What can education do? What can health do to support young people?
So what do we understand about urban environments and mental health?
There is a really mixed picture here. We know that there are characteristics of urbanicity that can be detrimental. For example, pollution and violence, the sense of lack of safety, discrimination. But we also know that there are elements that can be beneficial or have mixed effects. We know that green space, for example, access to green space that's safe can be beneficial to mental health. We know that population density and mobility in urban settings can influence the way people interact with each other, can influence social norms in a given community. And these in turn influence the kinds of behaviors that people are involved in. And those behaviors can affect risk for mood, anxiety, or substance use disorders. At the same time, we know that cities are unusual in that they offer real opportunities for wealth creation, for education, employment, for exposure to social and political and cultural diversity. They have a lot of advantages, which people often call the urban advantage. But those advantages are not equally distributed. And at the same time, social isolation and neighborhood poverty and discrimination are among determinants of poor mental health in cities. So it's a mixed picture, but evidence suggests that on the whole, urban environments tend to increase risk for mental health conditions.
And so why did you focus here on young people?
We focus on young people because part and parcel of adolescent development is really learning to interact with the environment and learning to interact with the complexities of the environments around them. So the physical environment, the political environment, the social and cultural environment. And adolescents have a heightened sensitivity to the context in which they live and a heightened sensitivity to social evaluation. And we felt that they might be particularly sensitive to what's happening, the kind of cues that they get exposed to in an urban context, like discrimination or violence. But similarly, opportunities for exploration and creativity that cities can offer might be particularly salient to young people. So at a time when we live with the world's largest population of adolescents who are growing up, and at a time when the world is undergoing a period of incredible rapid population growth and increasing urbanization, this seemed like a really interesting intersection to focus on young people and cities and how urbanization can affect them.
So tell me about the study. What did you do?
We recruited a large group of people. Our goal was to figure out if we could identify priorities for making cities friendly for young people with respect to their mental health. So we did a few things. We put together a scientific advisory board. And we did that because we thought, you know what, if we want to think about cities and we want to think about mental health, we need to be able to get in touch with people who can talk to us not just about mental health, but could also talk to us about urban design, could also help us think about education, could help us think about the justice system, all of these domains in cities that could have an impact on youth mental health. So we put together a scientific advisory board that brought together people from diverse disciplines, and we invited all of our scientific advisory board members to nominate people who should be a part of this priority setting study. We also put together a youth advisory board because we were focusing on young people and we wanted young people to be a part of the planning for the study and to also help us reach out through youth networks so that we could get the input of young people. So we established these two boards, scientific and youth advisory boards, and asked them to nominate people who had some area of expertise related to youth mental health and the urban environment. Our group of advisors nominated a robust group, hundreds of people, and we ended with a group of around 500 people who agreed to participate in the study. We sent them 3 different surveys, but the most important question that we asked these folks was, what are the characteristics of a mental health friendly city for young people? And we looked at their responses. We asked them questions over 3 surveys, but the purpose was really to help us to whittle down those responses so that we could arrive at a few recommendations, a handful of recommendations for what makes a city mental health friendly. And so that's what we did.
So what does make a mental health friendly city for young people?
That's a great question. So as we asked people these questions and as we began to look at the responses, we recognized that what's really important to understand about cities and the kinds of actions we need to take is that these actions need to occur at multiple levels. So we grouped everyone's responses into what can we do at the personal level for individual young people? What's important for their interpersonal relationships? What's important at the community level? What's important at the organizational level in cities, policy level, and the broader environment? We learned a few things. If you look at the priorities that rose to the top at each of those levels, at the level of the individual, the respondents in our survey felt it was very important that a city could support teaching young people life skills that gave them the opportunities for personal development and provided resources that could allow them to flourish. A lot of the responses at this personal level were about helping young people to be able to reflect, to be able to understand and manage failure, to persevere, to be able to develop resilience, empathy, compassion. So people thought very broadly about what are these sets of skills and qualities that could help young people to thrive in an urban environment. And that's what many of the characteristics of a city focused on at that level. At the next level, this interpersonal level, the lead response was around a city that is open-minded, that really values the feelings and opinions and choices of youth and enables youth to express their uniqueness. And so participants talked about opportunities for young people to engage in safe and healthy relationships and opportunities to engage in relationships with people who respected them, people who were able to accept criticism and critical analysis. And an importance was also placed on intergenerational bonds, right? Ensuring that cities could support these intergenerational relationships that young people need. The responses at the community level really emphasized young people having access to free and public spaces where they could gather and learn and socialize together. So creating spaces that were safe for connection rose to the top of the community interventions. And as for organizational interventions, ensuring that youth had not just employment opportunities, but that they could actually get access to jobs with security and jobs that could support their own sense of satisfaction as well. At the level of policy, the policy intervention that rose to the top was cities that are designed and planned with youth participation. So ensuring that young people are part of the design of policies and that policies overall support equity, whether that's attention to gender equity. We found that our participants were very concerned about ensuring that mental health friendly cities reduce discrimination and increase equity of all kinds. And finally, at the environmental level, I would say the lead recommendation was that these kinds of cities should address the social determinants of health, which we know have ramifications for people's mental health. So that's a big summary of what we found. And I think an important takeaway from what we found is that there is not one domain in a city government that can address all of these. Education rose as an important, emphasis for young people. Access to equitable mental health services arose as an emphasis for young people. So it's clear that multiple domains of city government, city leadership would need to come together to support youth mental health. And I think another really important finding was that young people themselves, as well as other respondents, talked a lot about the importance of youth engagement and youth participation in cities, youth participation in developing services, youth participation in developing policies, but ensuring that young people are engaged in helping to create the cities that would support their well-being.
So where do we go from here?
Where do we go from here? So one of the exciting parts of this study was that we had representation of people coming from 53 different countries and regions around the world. And even when we talked about this study as an advisory group, we recognized that for a city to take this forward, they'll need to sit and look at these priorities in context, right? And say, well, what does our context need, right? We see this set of priorities. Where do we want to start? And that probably starts by saying, putting together a group in the diverse environments where we hope people will move this kind of work forward, but ensuring that you're bringing together a diverse set of young people, you're bringing together stakeholders and decision makers that are coming from the parts of government, that you're bringing together folks from the private sector, social entrepreneurs who can add to the creative thinking around what cities can do. I think another equally important piece of this is there's a research element to this as well, which is to say, we've got a wonderful set of priorities. How do we understand the evidence for all of these priorities? So there's a role for the research community to organize recommendations for cities around where do we have the most evidence? What seem to be promising practices, perhaps? Where do we have the opportunities to study how we might implement some of these interventions for young people in cities? And how do we create this as a learning and dynamic process that cities might commit to?
It sounds very promising. It's just a matter of getting everybody on board.
Yeah, a lot of getting on board. And I think part of getting people on board is helping people to recognize, okay, what's in this for me? If I'm a minister of education, how does supporting young people in their mental health help us to achieve educational goals? Well, we certainly know that young people who have good mental health are more able to engage in education and more able to successfully complete education. So I think part of the task of getting people to get on board is helping people understand the benefit of working toward dual outcomes, their own outcomes as well as mental health outcomes, and seeing the benefit of this sort of shared effort.
Pamela Collins, thank you so much.
Thank you. It's a pleasure to talk with you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.